Today, I'm going to be talking about caregiver-implemented interventions for feeding disorders in children with ASD. All right, so first, before I start talking about some of those interventions, I think it's important to differentiate the difference between picky eating and a feeding disorder. So this is from Autism Speaks, a 2016 article. And they talked about the difference between selectivity and picky eating and feeding disorders. So for selectivity with a picky eater, children may have favorite foods, but they will tolerate certain variations of these favorite foods. Whereas with a feeding disorder, they will only eat a specific brand of a favorite food or only foods of a specific shape or color. Children who are picky eaters may resist certain foods with relatively mild behaviors, such as whining or pouting, whereas a child with a feeding disorder may exhibit extreme anxiety when pressed to eat certain foods, and they may act out with highly disruptive behavior. A picky eater can find other things to eat outside of the home at parties, sleepovers, or restaurants, whereas a child with a feeding disorder must bring desired foods when going out, or they must eat at home beforehand. So next I want to talk about the link between feeding disorders and ASD. So according to Diaz and Cosby in 2016, 46 to 89% of children with ASD experience feeding disorders, which compares to 25% of typically developing children. These feeding disorders are often characterized by food refusal, food selectivity, or challenging mealtime behaviors. So why is caregiver involvement in feeding disorders so important? So first, caregivers prepare and present most meals, which make them the ideal first-time interventionists. Second, caregivers acting as therapists can promote generalization into the home. Third, caregiver training is cost-effective and potentially increases the dosage of intervention because caregivers are usually with their child for multiple meals throughout the day. And fourth, caregiver training can improve access to intervention for families who otherwise might not have access to specialty feeding clinics with expertise in ASD. So I'm going to talk about 4 common caregiver-implemented interventions, and those 4 will be reinforcement and communication, systematically increasing expectations, non-avoidance strategies, and prompting. So the first one is positive reinforcement and communication. Positive reinforcement occurs when a desired behavior is rewarded with something desirable, such as providing a preferred food after target food was consumed. So, a study conducted by Cosby and Muldoon in 2016 evaluated the effectiveness of a family-centered feeding intervention for promoting food acceptance in children with ASDs. So, the strategies they used were maintaining a positive tone, using a token-based system, using visual menus and hierarchies, and increasing communication. So those visual menus allow the child to decide what they wanted to eat. And then second, the hierarchies were for the caregivers as a reminder of what target level needed to be reached prior to reinforcement. And finally, increasing communication during meals taught the child to communicate food refusal appropriately. So the results of this study were that they found that children were desensitized to less preferred foods, they increased food acceptance and dietary diversity, and decreased challenging behaviors during mealtimes. Next, systematically increasing expectations. So systematically increasing expectations involves the gradual fading in of less preferred foods and the gradual fading out of more preferred foods. So Penrod et al. In 2010 conducted a study to determine if children with ASD would increase food consumption and accept systematically. So they began with an entire plate of familiar food following one bite of a novel food, and then they progressed to a more balanced presentation of the foods. And surprisingly, they found that food consumption and acceptance actually increased for the child. The third one is non-avoidance strategies. So non-avoidance strategies prevent the child from escaping interactions with a novel food. So Gale et al. In 2010 conducted a study to determine if non-avoidance strategies were effective for increasing acceptance of non-preferred foods in children with ASD. The strategies they used included presenting food on a spoon for 30 seconds unless acceptance occurred. If acceptance occurred, this resulted in positive reinforcement, and then the meal would end after 20 presentations. And they actually found that acceptance and mouth cleans increased while disruptive behavior decreased, and effects were maintained at follow-up. And the last one we're going to talk about is prompting. So Najwatsky et al. In 2010 conducted a study incorporating a 3-step prompting sequence to encourage children with ASD to consume new foods. This prompting hierarchy involved first vocal prompting, and then gestural prompting, and next physical prompting, depending on what the child responded to. They actually found that the percentage of swallowed non-preferred target foods increased significantly, and generalization to untargeted foods was observed. So my conclusion and takeaway for this presentation: all intervention techniques can be effective in natural contexts with parents as interventionists. Feeding therapy is very individualized, especially with children with ASD, so what may work for one may not work for the other. And my takeaway for today is examples of picky eating and a feeding disorder. So if you are concerned that your child may have a feeding disorder, you can go to this link and compare the behaviors between picky eaters and feeding disorders. And if necessary, you can contact your primary care physician or a speech language pathologist for a feeding evaluation. Thank you.